74, more than 90% of the individuals 65 to 74 have been vaccinated in the state, and more than 80% have been vaccinated that are 75 and older. Tomorrow, roughly 12,000 new vaccination appointments will go live at vaccinateri.org, vaccinateri.org. So we have some updates that will take effect on May 7th. You'll get more details, but let me just give you the overview. It's because of the great work, as I just said. You can put up a slide. I believe there's a slide that you can put up now just to kind of go over some of these details so we can share that with the people that are watching. So we're looking at May 7th and May 28th. That's May 7th and May 28th as key dates. Starting on May 7th, in partnership with the Department of Health, we're now announcing mask wearing guidance will move from being required to recommended outdoors as long as it's a 3-foot distance. Masks are still required indoors. I'm pleased to say that today's announcement will provide meaningful relief for every type of business. As of May 7th, that's the week of Mother's Day, please make your lunch or brunch reservation. All industry sectors like restaurants, gyms, and houses of worship can return to 80% of their pre-COVID capacity with a 3-foot spacing inside and a 3-foot spacing outside. Again, we're going to 80% of capacity across all industries with that 3-foot spacing. There are also additional areas of flexibility we are able to provide different types of businesses. For example, beginning May 7th, in restaurants, party sizes will not be limited to a certain number. Catered events will increase to 200 indoors and 500 outdoors. And then we're removing the testing requirement for catered events, except for the student catered events like proms. Stefan will walk through some of the details momentarily that have to do with what's happening at the beginning May 7th. As of May 28th, we will lift all capacity limits and just require 3 feet spacing with masks still required indoors. Again, that's May 28th that we're lifting the capacity limits, and then we'll require the 3 feet distance, and indoors the masks will still be a requirement. As of today's announcement, we provide this meaningful relief to every type of business in the state. And we've been hearing from them, and I've been talking to them, and we know that they need that relief. Again, we're doing this incremental flexibility based on the safety and based on the shots that we've been able to get in the arms, and we accelerated that. We've moved this up a week. And as a small business owner, a former small business owner, a week is a lifetime. So that's very important that we save every day that we can and do it in a safe way. So restaurants will be able to fit additional tables indoors just in time for Mother's Day. And of course, we're praying for real good weather, and they'll be able to go outdoors as well. Just as an example, just giving you an example, I visited one restaurant yesterday in Federal Hill. Their capacity is going to grow by almost 30 seats, and they do 3 different shifts. That's 90 meals that will be served in that particular restaurant in Federal Hill. That's a great deal of money for the restaurant, but think about also the gratuities that the servers are going to receive as well. And you do that across hundreds and hundreds of restaurants through the state of Rhode Island. That's why it's so important that we hit this date and create this flexibility we're talking about. Gyms, especially our small fitness studios, have had limited numbers and decreased revenue because of the 6 feet requirement. We will now be able to increase the number of participants in their classes. Our caterers and wedding planners will be able to tell their clients that there will be regular dancing this summer at their weddings. Again, we want to make sure, we know that we're talking to wedding planners right now, and our message when we said a few weeks ago there'll be music in Newport during the summer was a signal to everybody that if you got a wedding planned for this summer, you're going to have a good experience. You're going to have a good wedding right here in Rhode Island. There's no need to move to another state. So we're going to stay the course, and masking and testing are still strongly recommended for people who are not vaccinated. Very important there too. And Dr. Alexander Scott will mention this. Vaccinations keep you safe. If you're not vaccinated, you run a risk. I talked to a friend that was in the hospital this week, So we all, even though the hospitalizations are down, the risk is still there. Get vaccinated. That's the most important thing that we can do right now to help our state. Sports upstate starting April 26th. We're opening up the last group of higher risk indoor sports. Wrestling and karate are back. That means high schools can have wrestling this spring. And starting April 26th, spectators beyond parents and siblings can cheer on their teams. And I know they're looking forward to that. Please respect individual building capacities and keep wearing your mask inside. Finally, starting May 28th, the restrictions on out-of-state teams playing in tournaments in Rhode Island will be lifted. This allows our indoor sports facilities and other venues to host events subject to restrictions, but starting in May, and to plan to book these events all summer. They can book them all summer. This is important for our economy and for our athletes, and we welcome the news from many leagues. Like I said, we're not going to put the mission accomplished sign up yet, but we're getting close, as you can tell. We're not at the finish line, but we want to get there safely, and we're going to do everything we can to make sure that we keep our safety as our top priority. And again, let's get vaccinated. Don't wait till tomorrow. There's appointments available. It's certainly being reported in the newspapers. And let's take advantage of those extra doses that the state of Rhode Island received this week because we have built out the capacity, as I mentioned earlier, to as many as 160,000 shots in any given week. We can with the supply right now, we can put well over 100,000 shots in the arms this week alone. So please, you wear your mask. Let's vaccinate the Ocean State. Let's stay positive, test negative. And I'll turn this over to Dr. Alexander Scott now. Thank you.
Thank you, Governor. Good afternoon, everyone. Looking at our data, where we always want to stay grounded and start with, we have 318 new cases to report out of 19,275 tests, which is a percent positivity of 1.6%. That continues to lead the nation in terms of the testing that we have been able to maintain. And as I had said several weeks ago, with that confidence, we know that that's how we can build out the strong vaccination program that we have as well. We have 114 people currently hospitalized. We saw a small increase in our number of new hospital admissions over the last week. And sadly, we have 2 new COVID-19 fatalities to report. The importance of sharing our condolences with the families of these Rhode Islanders is a critical reminder for us that we have to stay vigilant. Tom McCarthy will give an overview of where we stand with our vaccination campaign operations, but I want to really echo the sentiments that have been stated about where we are and what it means from our vaccination campaign standpoint. It's important to know that the moves we are making are based heavily on what we feel we can achieve together with getting everyone vaccinated. That protection from being vaccinated makes all the difference in the world when it comes to reopening our economy. Last week, we shared 2 target dates in May and June as key milestones for vaccinating 70% of our eligible population and then 70% of our population overall. Because of the strong work we have continued to do in terms of vaccinating, we feel comfortable announcing that those dates have been moved up 1 week a little bit earlier in May, because we're continuing to push hard on vaccination. And I want to spend today really helping to make sure you understand the responsibility that's in place for protecting yourself, your loved ones, and your household. I do really want to emphasize that the changes the governor referenced and that Secretary Pryor will be sharing in more detail, these changes are really geared towards people who are fully vaccinated. By fully vaccinated, I mean you've had all of your recommended doses for vaccination and 2 weeks have passed since that time frame has occurred. The key with that is when you are fully vaccinated, that's when you can have the protection and confidence in being able to go out and enjoy as our economy is reopening. What we're doing today is making clear that we're moving away, we're slowly shifting from the requirement in the environment realm and moving towards the realm of personal and family responsibility and accountability, and making sure that you are equipped. We know the testing that's available for everyone. We know the vaccines that are available for everyone. We have reached a milestone. 500,000 Rhode Islanders have received at least one dose of a vaccine. That's tremendous. It's a huge credit to the entire team. We know the vaccination team is still being run directly through the Rhode Island Department of Health, and there is an amazing statewide effort that's there to support that. But there's more to do. And we recognize it's time for our businesses to continue to get some relief. The governor has said continually, we want to make incremental changes. So we're at a point of being able to do that so that we can support our businesses and help to make sure that you and your families are informed about how you can continue to protect yourselves. There's some key messages with making that shift. Key is knowing outside is always better. Take it outside, go to restaurants outside, stores, flea markets, exercise outside. Coronavirus does not spread as effectively. Outside is a lower risk. Whenever you can take it outside, do that. Avoid crowds. Make sure you continue to wear your mask. The governor is leading and ensuring that masks, particularly indoors, continue to be required. Stay home if you're sick. And based on the dates that we're sharing, do everything you can to get fully vaccinated. Any of these reopening criteria that we are sharing today are fully intended for individuals who are getting fully vaccinated. We want to make sure that we're continuing to be clear about that, because the changes that we're making and supporting businesses, but still ensuring that you are informed, is because the virus, the science of the virus does not change. The public health elements of how coronavirus spreads does not change. If you choose to go within less than 6 feet of someone for a sustained period of time, regardless of what the requirements are in various settings, your risk for coronavirus is higher if you are not fully vaccinated. This is where personal decision comes into play, and we've been together long enough that we are confident that you have the information you need to make the right decisions that you need to make. If you're not vaccinated and you show up to a church or a store or the gym and it's really crowded, you should think twice about going inside. You should think deliberately about going to get vaccinated so you can enjoy some of those things. We're supporting and going to be working in partnership with Secretary Pryor with businesses to be able to proclaim employees are vaccinated. We have good ventilation. We're working hard to make sure that you are safe. This is a safe place to shop, a safe place to eat. And we want to make sure everyone has the information that you need so that you push yourself and your family members to go get vaccinated. The COVID-19 landscape today is not what it was a month or two ago. Every day that you don't get vaccinated, your risk of getting COVID-19 becomes higher and higher. Anyone who's starting to embark on these activities as we're reopening and you're not vaccinated, engaging in any of these activities are high risk. They are intended for people who are fully vaccinated to be able to really enjoy and be confident that their risk for spreading COVID-19 is low. It's key to know that you want to get vaccinated even if you have had COVID-19 in the past. We know that vaccines lead to very strong protection from infection. And the variants are circulating. So even if you have been infected and developed immunity from one infection, it may not involve good or adequate infection with a different variant. The vaccine has been able to show its effectiveness. It may differ a little bit, but it is effective in protecting you against these variants. And the variants are continuing to spread. So the more you are out there and not vaccinated while people around you continue to get vaccinated, the variant coronavirus is looking for the people who are even more susceptible. So the quicker you can go to get fully vaccinated, the quicker you can be confident that you're going to be protected. Particularly with knowing that our children do not have access to the vaccine right now. So if you have children in your family, children around you that you're exposed to, you getting vaccinated helps to protect them. People are going out more now and into stores and into restaurants and playing sports. We need to make sure that those who have access and are eligible for vaccination go to get fully vaccinated, so those who are around them, whether they are immunocompromised or whether they are the children in your life that you love, the best way to protect them is for you and your loved ones around them to get vaccinated. And if you're going out into the public, you want to make sure as many people around you have that protection as well. The key is for everyone, these are the safest things to do as we go forward. I'll repeat them what I said earlier. Doing things outside, transmission is significantly less. Avoiding crowds whenever possible. Wear your high quality mask, even when you're outdoors, and limit the interactions of people when you're indoors. Stay home when you're sick. And of course, get vaccinated, fully vaccinated as soon as you can. If you're thinking about Mother's Day now, know that it will be much, much safer doing it outdoors, wearing your upgraded mask, staying away from crowds, and if you and your family members are vaccinated. We are so close. We want to walk across that finish line with our heads high, standing strong, confident in the tools that we have. We need to remain vigilant and keep doing the basics. The science, the public health does not change. These are the things that are going to allow us to be able to enjoy that wonderful summer that we are looking forward to in Rhode Island. And with that, I'll pass it to Secretary Pryor, and then after Tom talks, we'll be happy to take questions. Thank you.
Good afternoon. It's great to be with you once again. This is a terrific day for small business and all business across Rhode Island. I want to thank Governor McKee and Dr. Alexander Scott for enabling this progress. It does come with some conditions and some caveats that we want to reiterate. It's extremely important that we continue to follow the rules and that we continue to undergo this process of responsible reopening working together. But let me reiterate some of the key points that the governor's made about the reopening itself and make some of these additional points that I've just referenced. First, beginning May 7th, across all settings, we will go to 80% occupancy. That's 80% of original occupancy pre-COVID with 3-foot spacing indoors and out. That means a lot of relief for businesses. It means new tables within restaurants. It means more patrons of retailers. It means that gyms can more comfortably operate. But please heed the words of Dr. Alexander Scott. If you, as a Rhode Islander, are not yet vaccinated, you should still be cautious and you should get vaccinated. If that is something that you are willing to do, please do so when an appointment is available. It does protect your health, and please protect your household's health. But we're so pleased that we've been able to offer this additional relief. What does the May 7th set of changes mean? It means that businesses in various venues that are currently at 50% or 75% of capacity or are operating under 1 person per 50 square feet can all go to that 80% of capacity level. Depending upon the setting, they change from that 75% to that 80%, that 50% to that 80%. And they are all required to incorporate that 3-foot spacing that we've described in the new version. There will no longer be, so let me talk about some of the specific changes. For restaurants, there will be no capacity restriction on outdoor dining, but 3 feet spacing is still required. There will no longer be a cap on the number of people per table at restaurants. So no longer will we require a count of 8 or 10 at a given table. For May 7th, there is still no standing service at bars allowed indoors. So bars cannot return to normal where a large number of people belly up to the bar. The conditions don't yet permit that. However, bars operating outdoors are allowed to have standing service because, as Dr. Alexander Scott has said, outdoors is safer. So you'll see within our rules in a number of instances, we favor the outdoors to encourage Rhode Islanders to conduct their business and undergo activities outdoors. Regarding catered events, beginning May 7th, catered events will be able to operate at 80% of a venue's capacity, up to 200 people indoors and 500 people outdoors. Essentially, we've accelerated by a month with those sizings, and we've also opened up even more outdoors with those numbers, 200 indoors and 500 outdoors. We're very pleased with that progress for the wedding industry, for the catered event industry of Rhode Island. It means that this will be a wonderful summer for catered events throughout our state. Testing is no longer required for catered events as a universal rule. It is still encouraged, so testing of participants in catered events, of the customers, if you will. But I will note that for catered events looking to reopen their bars or have cocktail hours or cocktail parties within the catered events, that will only be enabled through the use of testing or proof of vaccination during this initial May 7th segment of time. And we are allowing for bar service to continue in catered events May 7th forward outdoors. Venues of assembly beginning May 7th. Venues of assembly will be allowed 80% of capacity, capped at 500 people indoors, no cap outdoors. 3-foot spacing is required. Events over 2,500 will be asked to submit to DBR for review, and municipal approvals remain required at the city or town level. Now, a few words on May 28th, the next segment of this reopening. Beginning May 28th, we'll be at 100% capacity for all of our industry sectors, with 3-foot spacing still required indoors. And that's an important notation. It's not 0 spacing, and some may ask why. The 3-foot spacing does matter, and it is a deliberate signal. In collaboration with our health colleagues led by Dr. Alexander Scott, what we're expressing is it's not time to completely let your guard down. In fact, you should be very cognizant of your own situation and your household situation, and please get vaccinated to increase your level of safety and and how healthy you can be assured that you are. So beginning May 28th, restaurants, gyms, retail, personal services, offices, as well as houses of worship and funeral homes will all be at 100% of capacity with that 3 feet spacing. Okay, indoor bars will be able to take down plexiglass and resume standing bar service at that time, as compared to the only outdoor option available May 7th and forward. We will be able to, starting on May 28th, to have open dance floors as per pre-COVID with masks at weddings, both indoors and outdoors. So for all of those changes involving venues of assembly and catered events and those restaurants that are now seeing relief, we truly want to thank the many stakeholders out there who have advocated and done so intelligently and with ideas, with sophistication, and with really persuasive arguments about what would be possible. Dale Venturini, Rick Simone, Luke Renchin, Erica Trombetti, and Chris Parisi among them, from the Hospitality Association to the Ocean State Coalition and the Small Business Coalition and beyond. We're very grateful for your input. We couldn't be making these changes without you. And we're very pleased that we've been able to make this progress. Now, you heard from Dr. Alexander Scott that we are permitting these changes in these settings, but we recognize that some business owners, some heads of organizations and churches and synagogues and mosques may wish to partner with us to implement their own rules, to be mindful of who's been tested or who has proof of vaccination, to improve their ventilation. If their ventilation is currently poor, they may want to know, what are the ways we can do this? What are the ways we can track this information? What are the ways that we can hit a standard on ventilation? So we're going to be working together to make ourselves available to you. But in the meantime, you can always call 521-HELP, our helpline, and we together, Commerce and RIDOH, are here to help you. But we're very, very grateful to Governor McKee that we are leading the way in our region in responsibly reopening the economy and keeping Rhode Islanders safe. Thank you very much. I believe it is Mr. Tom McCarthy's turn at the microphone. Mr. McCarthy.
Hi, good afternoon, everyone. Glad to be back up here to provide a brief update on our vaccination campaign. So as the governor shared, this was a big week for us. Now with the expansion of eligibility to those 16 to 39 years of age, all adults are now eligible for the vaccine. We've been off to a great start so far, already on track to vaccinate more Rhode Islanders this week than we did last week. Between Monday and this morning, we've made more than 15,000 appointments, and about 75% of those have gone to Rhode Islanders 16 to 39. As I've shared in the past, we've done a lot to build out our vaccination capacity throughout the state to be ready for this phase. We now have 5 state-run sites, 3 regional municipal sites, and dozens of pharmacy partners and local health clinics. So all that being told, we're sitting roughly at about 150 unique vaccination locations throughout Rhode Island. So what that means is that about 97% of Rhode Islanders live within 10 miles of a vaccination clinic. And as the governor shared last week, we've partnered with RIDOH to make sure that no person has to pay for public transportation to these sites. We're continuing to work to make vaccine as accessible as possible to all Rhode Islanders. One example is that we've started to pilot walk-up appointments to vaccination clinics. Generally speaking, registering in advance is always best. That way you know you'll definitely have a slot. But especially with availability this week, you can even register for clinics on the same day. So for this week, we're going to pilot walk-up vaccinations on Friday and Saturday at the Dunkin' Donuts Center and at Sockanosset Crossroads. The Dunk will be open from 9 a.m. to 6 p.m. and Sockanosset will be open from 7 a.m. to 9 p.m. So this is a bit of a different model for us that's slightly more complex. So we're going to pilot it this weekend and we'll learn and continue to adjust moving forward. With all of this happening though, we're always continuing to plan for the future. A lot of you have probably read or heard the comments from both the Pfizer and Moderna CEOs over the last few weeks about a booster dose. While we have don't have anything official on this yet, we're thinking about how to integrate our COVID-19 vaccinations into the more traditional practices of medicine. There may always be a place for COVID-specific vaccination clinics, but we envision vaccine being more accessible in places where you traditionally access healthcare in the same way that flu shots are today. So all this is good. We're in a great place with our vaccination campaign, and we're confident in the course towards reopening that the governor outlined. But as Dr. Alexander Scott said, reopening and vaccination are directly connected. Our successful reopening depends upon people getting vaccinated. Another important consideration for everyone is that it's not just about protecting yourself, but protecting those that cannot be vaccinated. I got my first shot this week on Tuesday at Saconaset because I want to stay healthy and safe. But even more important, because I have 2 young children that are too young to be vaccinated right now. So do your part, get your shot, help others get their shots, protect yourself, your loved ones, and all Rhode Islanders. With that, I'll take a seat and we'll open up for questions.
Governor, at this point, are you basically saying?
And then we'll move to.
Thank you, Tom. You might as well stay. How is it that you can open it up to walk-ups? Are you having a flagging interest in people signing up for appointments?
So this week, we definitely have more availability than we've seen demand, but there's a couple of different things at play. So I think something that's always been important to us is to be extremely responsive to what we're seeing. So noting the demand, we're looking at shifting towards the next phase where we continue to meet Rhode Islanders where they are, decrease and reduce barriers to getting vaccinated. So one of the things that the governor had shared is we are signing people up at a similar rate to what we've seen over the last few weeks, but we've never had more vaccine available in the state than we have this week. So that's part of what gives us the additional flexibility to offer that walk-up opportunity. We've done it already this week. We've had about 500 people walk up at some of our mass vaccination sites. Again, I strongly encourage people to register because then I definitely have a shot for you. But we'll also be offering walk-ups on Friday and Saturday as outlined.
Interest not falling off?
I think it's a combination of urgency as well as, the confidence that we've always been working towards. I think traditionally when large age groups have opened, people have recognized it's taken me several weeks to find an appointment. So I think that's part of it. But again, we are going to continue to learn and adjust and make sure it's as easy as possible for people to get vaccinated.
Governor McKee, good afternoon. So why are we still under a state of emergency?
Well, as I said, this is too early to put the sign up, mission accomplished. I think the doctor was very clear in terms of the risk for people who are unvaccinated. I just got a text from somebody that just got diagnosed with the COVID. So we're not there yet, and we're going to be safety first. We're open in a way that we believe is safe, and then we're continuing to look at May 28th as the next target date.
Drill down on exactly what that means. I've heard there's a financial component. What is keeping you from lifting the state of emergency? Are there any other components that we're missing? That there's money available from the federal government? What is it?
No, that's not it at all. I've mentioned that safety is the #1 priority. And, some people might be out there saying this is a dream. This is not a dream. This is a nightmare. And we got to make sure that we get over that finish line. And we're doing everything we possibly can to keep everybody safe. So the message is, as I said in my comments, we're going to stay the course. And that's what we're doing. And we're incrementally opening up, very sensitive to the needs of the people that own businesses. But we're doing it in a way where we believe that it's in their best interest what's happening right now. And you're going to hear from businesses that we've talked to yesterday that are feeling as though that we are making that progress and we're doing it in a way that's keeping their customers safe.
Are you basically saying,
Governor,
are you basically saying at this point, I know Dr. Alexander Scott used the term personal responsibility, that come the end of May, hey, we've given you the chance to get the vaccine. Now it's on you. If you don't take your chance to get it, you're putting yourself at risk, and that's why we're moving forward?
No, I don't anticipate that be the case. Personal responsibility is always in the mix, right? But come the end of May, if we stay on target to the numbers that we have, we're going to have a big portion of the state of Rhode Island vaccinated. And you'll see the numbers at the end of this week, as Tom said. We have more shots to put in people's arms in any given week than we've had since the COVID started and the vaccination started. So I think there's another, almost 6 weeks between now and May 28th. We're going to vaccinate, especially if we're able to get out, as Tom has suggested, and we've got these plans, obviously, that we're going to make sure that we're going to do reach out. We're going to be, I think, at Amgen next week with with several hundred shots. We're going to be at another, I think, electric boat at one point in time, many shots. That's a message out there that we've got businesses that got large numbers. We're going to go out to where people are and vaccinate them. So by May 28th, Brian, we expect to have a large portion of the state of Rhode Island vaccinated.
On that front, I know you talked the other day about going to colleges, and there's been some concern at URI and with the strains. Have you made specific plans to get the vaccine to colleges? And I know Tom talked about some of the reasons for there still being open appointments, but is there at all a concern at them not all being snapped up immediately?
Yeah, I think that we're going to end up on the college campuses. Right now, we're providing transportation, and the college campuses have indicated they're going to our sites. But you're going to see, as we get into that last 25, 30%, that we're going to get back to the local spots, exactly where we started. So we're going to be on site, back local. This is not over, to the question that was just asked by Jim. There's work to be done, and we're going to do that work. And we're willing to go out to high schools and vaccinate 16, 17, 18 if they want us there. When the time's right, we'll pull that, we'll make that happen.
Concerned about the appointments?
No, I'm not concerned where we are right now. I think that we're showing, there's reasons that we have extra supply this week. It's because we built the capacity, and we're going to continue to get the supply as long as we make sure that people show up and get their shots.
Governor McKee, irony can be loosely defined as a Rhode Island restaurant managing to survive a year of COVID shutdowns, then ultimately fail because of their inability to compete with government benefits, which have placed them in a position where they're functionally unable to staff up to meet consumer demand. Currently, House Bill 6218 is still currently pending, which would address these issues. What has been accomplished, and I want to stress, Rhode Island businesses are no longer interested in discussions, big meetings, lots of clipboards, lots of pontificating. What has been accomplished with regard to the Rhode Island employment crisis?
Well, it's a national thing, not a Rhode Island thing, right? So we've been in calls with national people. This is a national problem that has been brought on by a little bit less than in-depth thinking in terms of Washington, in terms of the impact it's going to have. We are definitely going to work on a Rhode Island solution. I would expect that that's going to happen within next week. And yes, we have been talking to the restaurants, so we're not ignoring the restaurants. And I understand it's not just the restaurants, by the way. Please don't think it's just the restaurants. It's janitorial services. It's daycares. It's childcares. So we can't look at it just as restaurants. It's a more global issue than that. And my feeling is that Washington has a responsibility on that, and I would expect that our plan will reflect that when it comes out.
Quick follow-up. House Bill 6218 has been pending for weeks. There is a solution locally. We are just a couple of weeks away from Mother's Day.
Phil, go ahead.
What can be done?
I just answered the question.
Yeah, Phil, go ahead.
Doctor, this morning, Dr. McDonald on a talk radio program said that we're seeing an increase in younger people with COVID-19. How young, how many, and what is that attributed to vaccine availability for people in that age group?
So it's a combination. We are seeing more cases among younger individuals starting from 10 to 24. That is connected to a number of things, one of which is the fact that those who are younger than 16 are not eligible for vaccine as of yet, which is why we strongly want to promote anyone around those individuals who is eligible run to go get vaccinated, to be able to help protect those around them. The others are that, things are opening up, the weather is getting better, people are getting more active, sports activity, different engagements are occurring. What we tend to see, however, is actually household transmission taking place. So as we continue to reach the milestones that we are striving for, 70% of our eligible population getting vaccinated by May 7th, and 70% of our entire population getting vaccinated by May 28th, we will see this occur less and less. But because of the variant and how more contagious it is, it's important, it's critical for everyone to know that we are not at the end yet. The more you can get vaccinated, the lower your risk will be of spreading coronavirus.
A number of percentage of the 1.6% positivity rate that are people who are age 10 to 16, even a rough estimate.
We do have that. We'll get that to you directly.
That info, James, Alexa, Patrick, Anita.
Governor McKee, this is James Bissett from the Providence Business News. Good day to you, sir. You may mention earlier that you were hoping to kind of reach out to colleges and even to maybe some high schools to try to encourage some vaccinations. We've talked to a couple of people over the last day or so, those that are in the 30s, where they still see some vaccine hesitancy among those between the ages 16 and 39. Even as of today, there's still about more than 5,600 vaccine appointments available on vaccineRI.org. So what do you think the state would need to do to really change its messaging in order to encourage the younger demographic now to really get the vaccines into themselves? And especially now with the state having this goal of May 28th to really, with the exception of masks, fully reopen, and with the hopes of not having to take that step back if people aren't vaccinated.
Well, you can ratchet up, you can continue to go where the people are and identify those areas. As I explained a little bit, I think that earlier Brian asked, am I concerned? I'm not concerned until we reach a week where we didn't vaccinate all the people that we have doses. And so I would expect that, this week we're going to vaccinate those 5,600. That's why we're here today. You still have time to do that. And we're amending the way that we're approaching, including walk-ups, as Tom said. And then we're going to go direct out to businesses. We're going to go direct out to anywhere where we feel as though that people are there. And in those particular age groups, we're going to make sure that we are doing the same thing with the BIPOC community, right? Same thing we did with the teachers, same thing we're doing the universities now. That's all in the plan. And I was on a White House call this week, and they were very recommended that you should have a month plan. So that's what we're in the process right now. I would be concerned if we hit the point where we have a number of vaccines, an inordinate amount of vaccines left over after any given week. Right now, we're not there, and that's why I'm not concerned. And I do believe that we're going to hit high percentages based on the activity that's going on right now.
People in person, do you think there could be some additional marketing things, like maybe doing some either YouTube ads or maybe reaching out to people on social media?
I think that what you're going to do is you're going to go where the people are. And we're backing out the numbers. I was backing out the numbers this morning with Tony Silva, talking about how we're going to reach higher percentages of population and higher percentage of population. If you're strategic in that way, if we're able to continue to get the message out, that's going to happen. And I believe that the state of Rhode Island is going to respond for many reasons. Safety issues, economic issues. We want to get the kids back to school. So I think it's all going to happen.
A few more questions, and just a reminder that we do have Director Floyd and Commissioner Tom Figure here. So I believe that Alexa was next.
Yep, Governor McKee, both Neighborhood and Blue Cross Blue Shield of Rhode Island have said that they will continue to cover COVID-19 treatment and tests as long as there's a state of emergency. Are you not ending that because of this reason whatsoever?
No, the reason that you have a state of emergency is because we still believe there is one. And when we get to the point when we don't feel as though we have one, we'll remove that state of emergency. And I think that there's many factors, but the main thing is the safety issue. And it's based on, I think I mentioned this weeks ago, that our goals was that 70% that Dr. Alexander Scott says. We've stayed true to that. We just got to hit those numbers and exceed those if we can.
Question as well, just a second one for Tom McCarthy, please. When you say that you want to reach people where they're at, and the governor just said that he would go to high schools, he would go to universities, what about people in extremely hard-hit communities that I know that you guys have focused on? Are you going to, certain zip codes in Providence and going door to door to people, not just to sign them up for the vaccine, but also to deliver the vaccine to them?
I think there could be an opportunity in the future. So as you know, we have been vaccinating homebound Rhode Islanders. We're continuing to look at other opportunities. I know there's been some fantastic work. The city of Central Falls, the mayor is going door to door, knocking on doors, having conversations. They're doing similar things in Providence and Pawtucket, but continuing to very quickly recognize that we need to make that shift. And as the governor shared, going to places of business so that, I have to work during the day and then take care of my kids at night is no longer a barrier. So it's things we'll continue to look at. I think what's also important too is, to put aside some of our kind of preconceived notions. What I'll say is we've seen really strong demand from our 20 to 30-year-olds, so far. So what we're trying to do is make sure that, we have a message that resonates with folks, recognizing all the different perspectives and backgrounds. But so far, the younger Rhode Islanders are stepping up, doing their part. Would love to see the rate increase among those 40 to 49. Nothing to wait for. I've got vaccines for you this week.
Given the low risk of infection outdoors and the desire to want to encourage folks to do things outdoors, why not lift the mask order when you're outdoors completely? Wouldn't that be a cleaner message, easier for people to understand and to kind of grasp and have the, well, if you're 3 feet, then it's you have to have a mask. You should keep it on you when you're outdoors. Why not just lift it for outdoors?
Specifically because the risk is low, it doesn't mean there is no risk. The risk does continue. It does not go away completely. So for right now, we want to take it in a step-by-step fashion. Still really encourage, if you're around people and you're outside, you don't live with them, wear a mask. Just because it's no longer required doesn't mean it isn't still recommended. Same for 6 feet distance. People have the opportunity to maintain the distance, the protection, the wearing the mask, and getting vaccinated, that we want to equip all individuals and all families with being able to do to protect themselves and to protect their household.
And Governor McKee, if you could elaborate on the unemployment insurance thing that you expect to happen, do you expect the General Assembly to pass the legislation that Director Welton has supported, or is there something else? Is there an executive order or something else that you're working on with regard to unemployment insurance?
Both, this is certainly an emergency for the businesses at large. So an executive order is a possibility, but you got to find the right formula there, right? Because we got to make sure that it works for all the businesses, and we're exploring that right now. If you have ideas there's no state that's figured this out yet, so we'll be the first if we do. And I intend to make sure, like I said, we're going to make sure that we'll use the $300 to an advantage. Put it that way, the federal $300 to an advantage, and we're going to make sure that we put a system in that does just that. Because, like I said, Washington didn't think this through. We sent letters. I sent letters to the Lieutenant Governor asking for this consideration or thought process when there was $600 when I was Lieutenant Governor. So we're in a spot where we got to figure out how to solve the problem. It could potentially be through an executive order. It could be through legislation, and we're working with DLT right now over the last several days since last week on this thing. So I would expect something to break, and we'll when we get the details for it, we'll certainly share that, because we want it to be successful once we come out with the ideas that I'm considering and others are suggesting.
We'll have the last question.
Governor, question about proof of vaccine and vaccine passports. A lot of states are curtailing the use of them. Does the state plan on using some sort of proof of vaccine requirement at catered events? I know the testing requirement is no longer there. Do they have to show that they've been vaccinated instead? Where does the state stand in terms of vaccine passports?
I think as Stefan has talked to that, we'll certainly work with individuals that want to make it that way. And, in there, part of the universities in the state are making a requirement for students to get on campus, I think broadly across all universities. So we'll work with anybody. And as Stefan mentioned, in terms of like help walking them through strategies that we can offer, that could be a strategy that we could help them through. But right now, we're not going to mandate that from our seat. We'll work with the local businesses and different organizations that are having these events to see whether that's something that they want to do. And if they feel as though it makes them safer and they could put a sign up that everybody in here is vaccinated, they may very well do that. And we're very happy to walk them through anything that they think is going to help their business or their activities.
With the testing requirement going away next month, do you plan on requiring at catered events proof of vaccine instead?
No, we're not doing that right now.
Lastly, we're still seeing hundreds of new infections a day. New York Times put us #2 behind Michigan. Will you continue to lift restrictions if this is the same case a month from now?
Well, it all depends where we are in terms of hospitalization rates and also the infection rate. So it all balances out. We're following the science. You get people vaccinated, we're not going to have that problem, right? So we need to make sure that's there. And also understand, the people out there understand that the metric that you just referred to, we're about what? It's about 100% more in terms of the spread between us and Michigan. We're nowhere near Michigan right now. I think they had 70 some odd percent, and we were at 40% or something like that. So the spread is significant. We'll keep an eye on that, but we're not close to where Michigan is right now.
Last question for Amanda.
Thank you. My question's for Janet. Can you speak to the indoor sports? What will restrictions look like? For example, will there be a limit on how many spectators can attend?
Thank you. So what the governor announced today for indoor higher risk competitions was that we will allow those to occur starting on Monday, which opens up, for instance, the wrestling season for high school spring sports. The occupancy limits for indoors still apply. The spectator rule that got changed allows not just parents and guardians and siblings, but also grandparents who are hopefully vaccinated and other folks to attend, so long as they abide by masking and any occupancy limits. We are strongly encouraging that there be testing, regular testing for anybody involved in sports, and particularly for higher risk sports. So for instance, the Rhode Island Interscholastic League is going to require that those who compete in wrestling have regular testing. So you make sure, and as mentioned over and over, 16 and under aren't being vaccinated. So you make sure if you're asymptomatic and positive, you won't be participating in a wrestling match. So I want to stress that we're sort of opening up this last group of sports that hasn't been allowed to compete, but urging that people do it with every modification that can help prevent spread of COVID for the athletes. Things like for wrestling, they're going to have pods. You don't have different weight classes wrestling against one another anyway. They're going to have other modifications in place that will prevent transportation or things where a lot of the spread's occurring outside of sports. So trying to prevent people from being too closely congregated. I think one of the things we've seen is that the high school sports and the middle school sports have been very well organized and disciplined. We want to get the word out more to other rec leagues and recreational sports where we think that maybe more attention and needs to be paid